My next guest is Congressman Jimmy Panetta, a Democrat from California and member of the House Ways and Means Committee. Along with Congressman Murphy, he is the co-sponsor of the Medicare Patient Access and Practice Stabilization Act. Welcome, Congressman.
Thank you. Appreciate this opportunity to talk about something that's very, very important in my district in the Central Coast of California.
Absolutely. You sit on the Ways and Means Budget Subcommittee. You recently called the majority's resolution a threat to working families, seniors, and students. Can you tell us on what the state of the current showdown is?
Yeah, look, I think obviously with the budget resolution that sort of sets out the framework for a reconciliation budget package, what they called for were a tremendous amount of cuts. And that's why I said there's potential for it to be a real threat to working families, especially with programs like Medicaid, student loans, student lunches, Head Start, and so forth. And so people need to understand that, especially the public, that although it may, sound good to have tax cuts or tax cuts for billionaires, the fact is that the Republican majority and Speaker Johnson want to pay for it with these types of cuts. So that reconciliation resolution package passed out of the budget committee, and I voted against it. I actually offered a couple amendments to make it a little bit better. Those were all voted down by the Republican majority on the budget committee. And then it went to the House floor and it barely passed by one vote. Now what you're seeing, because that resolution ordered the committees to then either have cuts or the Ways and Means Committee have a certain amount of spending, that's where the committees are going to be working on from here on out. So that's the process. Passed the committee, the budget committee, it passed the House. We got the framework. Now the artwork starts to be filled in the frame through each and every committee.
One area where there isn't too much divergence is the need to stabilize Medicare physician pay, which is why you introduced this bipartisan bill with Congressman Murphy. How hopeful are you that it's going to pass with the current state of Congress as it is right now?
Yeah, well, that's kind of a two-part question there. One, I believe in my bill, especially having an excellent partner like Dr. Greg Murphy from North Carolina, the bipartisan bill, the Medicare Patient Access and Practice Stability bill that would offset the 2025 Medicare cuts by 2.8%. And then take into account inflation and basically adjust those types of Medicare reimbursements by 50% for at least 1 year, which is a smart thing to do to kind of bring down cost. So it's close to 71 bipartisan members supported it last term. Hopefully we'll get more members on it this term because I think everybody understands the fact that Medicare is not keeping up with inflation. It's clear in my district. It's clear in Dr. Murphy's district. That's kind of the norm throughout the country, unfortunately. So we have to do something to ensure that the reimbursements are basically upped. And this is one solution that we hope we'll be able to get in any future package going forward, not just the reconciliation package, but possibly if there are negotiations, which there should be, in regards to the budget that comes due on March 14th.
In your view, why has physician pay become kind of a political issue now?
Well, I wouldn't say it's a political issue because this is so bipartisan. It's just what type of vehicle it gets tied into that can be political. Now, trust me, if it gets for some reason tied into the reconciliation package, and if the Republicans in a very slim and splintered majority can actually agree on something, hey, that's fine with me. I'll probably still vote no on the entire package because there's going to be so many cuts. At least that's what they're portending with the fact that the resolution had significant amounts of cuts in Medicaid, potentially even Medicare. And so that's going to be a real issue. And one of the main reasons why I'll probably vote no, especially if it's a partisan process. But look, like anything, if they want to negotiate, if Republicans want to negotiate with Democrats, we're more than happy to do that. And one of the things I will push for is the Medicare Patient Access and Practice Stability Act, a very bipartisan bill that, as I explained, basically will offset the 2025 Medicare cuts of 2.8%, and then it will basically tie it into inflation, or at least make sure that the reimbursements are at 50%. Look, why it's such a bipartisan issue is because, as we're seeing, it's Medicare reimbursements are not keeping up with inflation. In my part of the woods in Central Coast of California, it's one of the most expensive regions to provide care because it's about dealing with operational costs. It's about dealing with rent. It's about dealing with wages. It's about dealing with insurance. And those prices have gone through the roof. And unfortunately, these types of reimbursements aren't keeping up. And so what you're seeing is doctors who are already up there in age basically saying, I'm done. I'm out. I cannot afford to continue my practice. Or if I still want to practice and I'm still young enough to practice, I can't do it here in Central and Northern California or in California. It's too expensive. So they leave, unfortunately. And that's been a real issue. I've spoke with hospital heads who have literally provided new doctors, not just cars, but houses, because housing is obviously so expensive on the Central Coast of California. A year later, those doctors have turned in those keys to those houses because they just can't afford to live there, and mainly because reimbursement rates for Medicare are not keeping up with inflation, and we got to fix that, and the Medicare Patient Access and Practice Stability Act would.
You mentioned doctors being priced out of the profession or practice. You've been very active in trying to address the country's physician shortage, especially when it comes to treating Medicare patients. What have you learned in regards to what needs to be done to sort of, counteract this trend?
First and foremost, we got to up the reimbursement rates. Cannot stress that enough. They have to match the inflation. And that's exactly what Dr. Murphy's and my bill would do. Secondly, you got to offset those cuts that unfortunately were just created when Medicare was created. And right now we're looking at a 2.8% cut that came into effect in January of 2025. And so those are the two most important things to do. Third, you got to start thinking about general practitioners. I had a Medicare roundtable about a month ago in my district, and all of the hospital heads and doctors that were at that table basically said the GPs, our general practitioners, are just not coming out of medical school. They're having to specialize. Why? Because general practitioners aren't getting reimbursed enough when it comes to Medicare and even Medicaid. And so this is a real issue, especially when you start talking a reconciliation package that has significant cuts to either Medicare or Medicaid. And so this is something we want to stop. And our bill would at least kind of put a Band-Aid on that for now, at least for the next year.
You also recently introduced a bill to expand coverage for chronic diseases, and that is something that is a focus for the current administration under our current HHS secretary. How do you expect chronic illness and healthcare at large to be impacted when we're talking about this issue of Medicare physician pay being cut every year?
Yeah, look, I think we can walk and chew gum at the same time. And obviously, when it comes to healthcare, we're getting to a crisis stage at this point. When you're seeing cuts in Medicare, when you're seeing potential cuts in Medicaid based on the Republican reconciliation package, when you're seeing people with chronic diseases not have access to these doctors. And so that was the purpose of the bill that I spoke on on the floor this week in regards to the bill with Vern Buchanan, who's the lead author of the bill. I'm a co-lead of that bill to ensure that those people who have chronic diseases have more access, not just to doctors, but to insurance and to care going forward. So it's something where we have to realize that it's kind of an all of the above approach, especially when it comes to healthcare in the United States of America and the downward trajectory that we're looking at with those areas that I just discussed. And we need to step up as a body, a congressional body, a legislature on the federal level to ensure that it's fixed. We need to do that for Medicaid. We need to do that for Medicare, and obviously those with chronic diseases as well.
And while we're having this conversation, DOGE is also currently, making its way through the federal government. Do you think an effort to stabilize Medicare physician pay can coexist with this current effort to root out, waste, fraud, and abuse?
Look, with the right advocacy, I think anything can take place. And, I'm an optimist. I have to be in this job, especially with everything we're dealing with these days, including Doge. And the fact is that if you have Republicans and Democrats coming together on a bill like the Medicare Patient Access and Practice Stability Act, I believe it's something that hopefully those in the administration will listen to, especially when you look at access for seniors when it comes to Medicare. So even though you have someone like Elon Musk who wants to go in there and take a chainsaw, a sledgehammer, or a TNT to many of our institutions, to many of our agencies, or to many of our plans, be it Medicaid or Medicare, you have to work hard to convince them that it's a wrong thing to do. I was just had a meeting with my staff earlier, letting them know that we have to be a little bit proactive in thinking outside the box when there are certain cuts that affect our district to ensure that the administration hears about it. You just can't sit back and say, oh, there's a cut. What can we do about it? Nothing. No, that's wrong. We're here to represent the people of our districts and fight back. And I will fight for the people of the 19th Congressional District, especially when it comes to Medicare reimbursements, especially when it comes to these types of extreme cuts that Doge and Elon Musk are doing, not just to certain organizations and agencies, but what's going to happen is when they continue to do this, you're going to see government seize up. You're going to see the services that people rely on not get out there. And let me tell you, that's what I'm telling them. That's when you got to hold your representatives accountable. If you have representatives that support these types of cuts, you're going to lose services. And when you lose those services, that's when you better hold them accountable.
Thank you so much for joining us for this discussion, Congressman.
Thank you.